Good morning. I have to go off on this. I just came out of a room with a patient that really frustrates me, and I want to tell you about it. This is a 20-something-year-old, 25, 26-year-old man who came in with abdominal pain, upper abdominal pain. And like I always do, I want to know what is really causing this. I don't just want to treat his abdominal pain and give him some, acid blocking medicine like omeprazole or Prilosec or Protonix and say goodbye. Like, if we can figure out exactly what is causing this, like the really underlying root cause, to kind of get deeper on it, then we can fix this. Then we can start to at least treat the real deepest issue so that this is fixed and dealt with in the future. It doesn't cause this guy any problems. So the long and the short of it is do this evaluation and come to the realization. So, we check his blood. Whenever there's abdominal pain, look for the gallbladder. This doesn't look like his gallbladder. He had some liver abnormalities. Is this alcohol related? We checked his pancreas. So the blood test to check for the pancreas is called lipase. His was negative, so I didn't think it was pancreatitis. And it looked like, and then it comes out later, he's like, oh, by the way, yesterday I drank 12 beers all day. I was like, oh my gosh. So he drank a ton and it flared up his stomach. I would call that alcoholic gastritis, just inflammation in the stomach from alcohol. What's the treatment? Stop drinking. I mean, we treat him for pain and give him fluids because he was vomiting. We control all those symptoms, help him to feel better. Sure, like you can give him an acid blocking medicine, whatever, but the real treatment is stop drinking alcohol. So this is where I started to get frustrated with this. And this is addiction. It's addiction. It's complicated. There's so many layers to it. But I was trying to talk with him to kind of raise that this may be a problem. Have you been to the hospital? Kind of these red flags, kind of plant this little seed, because I don't think he had any idea. Have you been to the hospital? Oh, okay. So your pain and vomiting is from drinking. It's from alcohol. He's like, well, I'm not sure. I'm like, no. It is, without a doubt. Have you ever been to the hospital before because of your drinking? Well, twice before. I'm like, you've been to the hospital now 3 times because of how you use alcohol. Wow. Is that a problem? And he's like, kind of like not even thinking about it. From my perspective, this guy is on a track, man. He's on it's a train. He's on this train, he's on a track. And I can see way ahead, he is headed to a bridge that is out. And his train is gonna go, pew, like of these people that I see at the end, who when they're 40, 50, 60 and their liver is fried and they're gone, this is what they look like in the beginning. Where they're binge drinking and they're coming into the hospital where they've been drinking so much that it's significantly damaging their body, right? This is his 3rd visit, major red flag. Absolutely an alcoholic, huge risk to have permanent liver disease and to be one of these guys where the only thing we can really do to cure it is a liver transplant, which not everybody is going to get. So this is what gets me fired up. And so what I really want to know is and it's almost impossible to get to this in one visit. Like, you really need months, years of therapy to get to these underlying causes. But why does he drink? Why is he drinking? So I'm having this conversation with him, just kind of opening the door to maybe he's an alcoholic, which is, if he's drunk, if he's just floridly drunk, is a waste of time, right? Nobody's gonna hear that. But what I want to get at is, why is he drinking? Like, what's going on with that? This guy was a Mexican immigrant when he was young. Like, was he in a community where he didn't feel safe or normal, or he felt like he had to fit in, or there was something wrong with him just because he was an immigrant? Did he see this at home? He said no. He said his parents didn't drink. Did his brothers drink? Was this like a cultural thing? Now his friends drink. So did he get in with the wrong club? He was working, he did have a job, so how much of this is environment? What kind of trauma does he have? Was he abused? All of these kind of underlying things, because I want to know, what is is he just got like high anxiety? Like so we talked about it a little bit. He's like, I just like how I feel when I'm drunk. Just like how he was also on cocaine. It's like, I just like how I feel. So just kind of, okay, the euphoria of that moment. And from his perspective, oh, I just drank 12 beers, no big deal. In what world is drinking 12 beers normal? You can get away with it for a while. Some people aren't affected by it. You know, in what world is that normal? Like in a fraternity, you know, like where I went to college, I was the equivalent of a fraternity president. And that's about the only world where that's really normal. And that's unfortunate that it is, because it leads a lot of people to have problems. This guy's on this track where he's going to go like this, like almost certainly from his substance use. And I'm just like trying to slam this thing over, get this track moved, you know? I mean, what can I realistically do in the ER? What is it, 1 in 20 or 1 in 50 or 1 in whatever? Does that mean that we still shouldn't try and sit down and have these conversations and get real about it? And I think absolutely we have to try, you know. Realistically, most people aren't going to listen, you know. You're up against addiction. It's not easy. It's just, God, in what world is that normal? And just over and over and I just see this over and over and over and over again. All these things that are protective against it, and all these things that are put people at risk for it. What's the underlying thing, man? Like, let's. This is not just abdominal pain. Here's some pills. Get out of here. Like, let's really get at what is really going on here and talk about it. And just be no shame. Just be direct about that and go with that. So that's my rant today. Got me awfully fired up. Hope you enjoyed it. See you next time.